There's a condition that affects millions and millions of people all over the world. It's a relentless, quiet force working inside the body, and most of the time, it gives absolutely no warning signs. Yet it's a major cause of some of our biggest health problems: heart attacks, strokes, you name it. Today, we're diving deep into what doctors call hypertension, but you probably know it better as the silent pressure.
So here's what we're going to cover. First, we'll get into why it has that nickname, the silent pressure. Then, we're going to decode those numbers you see on a blood pressure cuff. We'll look at the causes and what puts you at risk, understand the long-term strain on the body, and, most importantly, talk about how to take back control. And finally, we'll cover those critical moments when pressure really peaks.
All right, let's start with the sneakiest thing about high blood pressure. It's silence. This isn't a condition that just shows up and announces itself. Nope. It builds quietly, sometimes over many, many years.
Seriously, just stop and think about that for a second. What if something was causing real damage inside your body right this minute, but you felt completely and totally fine? Well, that's the reality for millions of people.
And this is the absolute crucial point. The reason it's so deceptive is that most people have zero symptoms. No headaches, no dizziness, nada. It's usually found by accident, during a routine doctor's visit for something totally unrelated. And that lack of a warning bell, that's exactly what makes it so dangerous.
So what are we actually talking about? Well, medically, the definition is pretty straightforward. It just means that the pressure in your arteries is consistently too high. Imagine your body's plumbing system is running with the pressure cranked way up, all day, every single day. Eventually, that constant force is going to start to wear down the pipes.
All right, so we get what it is. Now let's talk about how it's measured, because it's time to decode those numbers. When you get your blood pressure checked, you always see two numbers, and getting what they mean is really the first step to taking charge.
Okay, this breaks it down perfectly. So you've got two numbers. That top one, that's your systolic pressure. It's the force when your heart is actively pumping. And the bottom number is your diastolic pressure. That's the force when your heart is resting between beats. As you can see, normal is considered below 120/80. The second you start consistently hitting 130 on top or 80 on the bottom, that's when you've crossed over into hypertension territory.
But, and this is super important, one high reading doesn't mean you have hypertension. Think about it. Your pressure can spike just from the stress of being at the doctor's office or from the coffee you just had. That's why a real diagnosis needs consistently high readings over at least 2 different visits. It's all about confirming that this is a persistent problem, not just a one-off spike.
So the big question is, why? Why does this pressure build up in the first place? Well, to answer that, we've got to look at the different types of hypertension and all the factors that put us at risk.
And wow, this chart really puts it into perspective. For a whopping 90 to 95% of people, it's what's called primary hypertension. And what that means is, well, there isn't one single thing you can point to as the cause. It's a really complex mix of your genes, your environment, and your lifestyle choices. Only in a small number of cases is it secondary, meaning it's actually caused by some other health issue, like kidney disease.
Now this slide is key because it really breaks down what's in our control and what isn't. On the left, you've got the non-modifiable stuff, things like your age or your family history that you just can't change. But look at that list on the right. Those are the modifiable factors. Your diet, how active you are, smoking, stress. This is where your power is. This is where you can make a real difference for your health.
Okay, so we've covered the what and the why, but now we have to talk about the really serious part of this whole conversation, the so what. What does all that relentless pressure actually do to your body year after year?
Your heart and your brain are right there on the front lines. All that constant strain forces the heart's main pumping chamber to get thicker and bigger, which can eventually lead to heart failure. It also damages the delicate lining of your arteries, basically paving the way for coronary artery disease. And in the brain, that same pressure can weaken blood vessels until they burst, causing a stroke.
And the damage doesn't stop there. Your kidneys are these amazing, intricate filters made up of tiny blood vessels. High pressure just scars them over time, which can lead to chronic kidney disease. It can also harm the super delicate vessels in your eyes and weaken the major arteries all through your body. The pressure is everywhere, and so is the damage.
Okay, I know that last part was heavy, but listen, the story absolutely does not end with the damage. In fact, for a lot of people, this is where a whole new, healthier chapter begins. So let's pivot and talk about the solutions, because this is a condition that you can absolutely manage and control.
Your first line of defense, your absolute foundation, is always lifestyle. And these aren't just small suggestions. They are incredibly powerful. I mean, studies have shown that losing just 10 pounds can lower your blood pressure as much as some medications do. This right here is the groundwork for taking back control.
But for a lot of folks, lifestyle changes alone just aren't enough to get the numbers where they need to be. And that's totally okay. That's where medication comes in. As you can see, there are several kinds of very effective medicines. They all work in different ways. Some relax your blood vessels, others help your body get rid of extra salt and water, but the goal is always the same: bring the pressure down and protect your organs from any more damage.
Okay, for our last topic, we have to talk about what happens when blood pressure doesn't just creep up, but it skyrockets to really dangerous levels. This is what's known as a hypertensive crisis, and it's a true medical emergency.
Now, the most critical thing to understand here is the difference between a hypertensive emergency and a hypertensive urgency. Both involve crazy high blood pressure. We're talking over 180 over 120. But the key distinction, the one that changes everything, is organ damage. If there's evidence that new damage is happening to the heart, brain, or kidneys right now, it's an emergency, and that needs immediate hospital care. If the pressure is just as high but the organs seem okay for the moment, it's an urgency. Both are serious, but one is a direct, immediate threat to your life.
So we've gone on quite a journey here. We've unpacked the silence, we've decoded the numbers, we've faced the risks, and we've looked at the solutions. But the power of all this information isn't just in knowing it, right? It's in using it. So that really just leaves one last question, and it's a personal one. Now that you understand the silent pressure, what will your next step be?